Welcome to this lecture about Bayesian reasoning as part of your guys' clinical decision-making course. Trying something a little different just so you can see my face and not just this disembodied voice talking to you on the lecture slides. This is something that can be really complicated and challenging, and we're going to try to keep it very simple and easy for you guys to comprehend and remember and use, because though it is really complicated, it's also really important for your practice of medicine. And always when we're practicing medicine, we remember that God made human beings, therefore human beings are exceptionally valuable, and therefore we really want to take good care of human beings. And that's true whether you're a Christian like me or Muslim like most of you guys. We want to take really good care of people. And to take really good care of people, we have to make good decisions about their diagnosis, about their treatment, about follow-up, and all of these things. And Bayesian reasoning will actually help us do this if you can really get a firm grasp on this concept in your minds. Okay, so getting into the concept of Bayesian reasoning. I don't know if you guys have ever heard of it before or not, but we'll just assume that you haven't heard much about it, if anything, and start from the beginning. So just a case to keep in mind, a very common case that can walk through your door into a primary care office or emergency room or wherever at any time. We're going to come back to this later, so just keep it in mind. How are we going to make decisions about this case? So Justin is a 13-year-old boy who has had sore throat, fever, and swollen glands for 2 days. On examination, he has exudative tonsillitis, that is, he's got little pockets of pus on his tonsils, and tender anterior cervical nodes, but no posterior cervical adenopathy. This gets back to your guys' lumps and bumps examination as part of CS1 and part of the Intro to Clinical Medicine course we've been doing this summer. Talking about how do you examine, for lymphadenopathy. What is this child's probability of having strep throat, right? Because most people who present to you with a sore throat and fever are going to have a viral infection, most. But we do worry about streptococcal pharyngitis, not because it doesn't get better on its own. It does in most cases, though there can be complications. We do worry about the long-term complications of things like rheumatic fever, which can happen about 0.1% of the time if we leave streptococcal pharyngitis untreated. So it doesn't sound like very much. 1 out of every 1,000 cases will get rheumatic fever, but if you think of how many people get streptococcal pharyngitis every year, it ends up being quite a lot. So we do want to reduce the risk of that. Therefore, we want to know, do we want to give antibiotics to prevent rheumatic fever because we believe this is streptococcal pharyngitis, or do we not want to give antibiotics to not promote further resistance to antibiotics by giving antibiotics that aren't needed because this is a virus? So we'll talk about how do we decide this. Okay, so this is Bayes' theorem. This mathematical equation at the top represents Bayes' theorem. Basically, you want to think about, well, let's just get into what this is, and then we'll go to a very simplified explanation of what Bayes' theorem is saying to us. So, if we look at this mathematical equation, it's representing something, and there's a lot of things included. The first thing, there's just this little straight bar up here. If I can get my pointer, there you go. This right here is just talking about conditional probability. So when we see it here, we're saying this is the probability, that's what the P stands for, of the hypothesis being true, that's H, given that the experiment or the investigation is true, right? So we're saying this little bar here means given. This is given. How true is it, or how likely is H to be true if we are given that E is true? Okay, 2 events. And the second event, H, depends on the first event, E. And you'll see it written as A and B. You see it written as B and E and other things when you look at Bayes' theorem. The H stands for any hypothesis whose probability may be affected by evidence or an experiment. So you can think of the E as evidence as well. E is the evidence that corresponds to new data, right? You kind of have a baseline suspicion maybe about what your patient has, and then you get new information, maybe from laboratory tests, maybe from the history, maybe from physical examination, and it changes the likelihood, the probability of your hypothesis being correct or not. H is the prior probability. It's the probability of a hypothesis being true before you have other information, before E is observed. This is the prior probability. Some people call it the pre-test probability. That's how I usually talk about it. Then here, when you have the probability of H given E, this is talking about the posterior probability, the post-test probability, people often say. And it's the probability of H being true given E is true. So it tells us what we want to know from Bayes' theorem. This is telling us the probability of a hypothesis being true given evidence we have observed, okay? And then lastly at the bottom here we have the probability of E, the probability associated with the evidence. This is sometimes called the marginal likelihood. And this is the same for all possible hypotheses being considered. Whether you're considering a hypothesis being true or not true. It's an experimental condition. It's a test we've applied to the data to give us new information, and it is what it is. It's not changing. It's not conditional on the hypothesis. Okay, that may sound really confusing, right? I wanted to explain it, and we'll come back to it and explain it again, but really here's what I want you to think about for this short lecture. Okay, are you ready? Here it is. Don't worry about the mathematical equation right now. This is the concept I want to bring home. I want to come back and explain that later in a separate lecture, but don't worry about the complex Bayes' theorem mathematical equation right now. Don't worry about it. All I want you to know is to focus on this, okay? The fact that we're talking about a probability of an event, a hypothesis being true. You might consider, what's the likelihood of this diagnosis in your patient given that B is true, given that we have more data, given that a test was done with certain characteristics, what's the probability of A being true, of this being your patient's diagnosis, or this being the right treatment for them, that kind of thing. So, Bayes' theorem is all about the probability of an event A given event B. It is conditional probability, right? A is conditional on B. The probability of A being true is conditional on the results from B. Okay, that's all we're talking about. So just think about it as this is the basic concept of Bayes' theorem. I don't care if you fully understand the math or how we derive Bayes' theorem or any of these things. We don't have time outside of a statistics course to go into all of that. But I do want you to remember this is the type of situation where Bayes is very commonly used in clinical medicine. There are many other situations where Bayes' theorem is really useful in the world of medicine and health technology assessment and assessing clinical trials, all of these things. But for you guys as rising fourth years in a clinical decision-making course, this is what you need to know. So with that, we're going to stop. We're going to keep this in a series of short lectures. Hopefully this helps you guys focus on the main points, the things that are really, really important, and not be at all unclear about what the important points are. For this lecture, this is the important point. Thomas Bayes, back in the 18th century, was a Christian minister who developed this philosophical, this theoretical proposition based in statistics that you can calculate the probability of an event A when it's conditional on some event B. Okay? He developed this, and it's become increasingly useful as time has passed on, and we need to interpret data. So I just want you to remember what Bayes' theorem is all about and the basic situation in which you will use it. That's all there is for this first lecture. Introduce you to some of the basic terms and concepts, and this is the main point of this lecture. Okay, so hold on to this one, make sure you thoroughly understand this, and then move on to the next lecture. This will be a series of 3 shorter lectures on Bayesian reasoning, or sometimes it's called Bayesian inference. Okay, so we're going to stop here for now, and I will see you guys when you're ready to listen to the next lecture.